Invented in 1977, ALZET Osmotic Pumps pioneered controlled drug delivery in the research laboratory setting. Direct Corporation acquired the ALZET product line in 2000, expanding its portfolio of drug delivery technologies. Direct develops and commercializes pharmaceutical systems for the treatment of chronic debilitating diseases, engineering systems that deliver a precise amount of drug to a specific location at the right time. Delivering bioactive test agents by conventional injections has many disadvantages. Injections deliver a high dose, which can overshoot the therapeutic level, causing serious side effects. The rapid decline that follows can even prevent the desired biological effects from developing at all. Often the validity and accuracy of an experiment can be improved if a constant level of agent is delivered at a steady, programmed rate. ALZET pumps provide this control. In addition, research shows that repeated injections and frequent handling of laboratory animals cause stress to the animals, resulting in pathophysiological changes, which may introduce experimental artifacts. Animals in multi-month studies with ALZET pumps demonstrated normal growth and reproduction. These miniature self-powered pumps deliver test agents around the clock for up to 6 weeks. Once implanted, the pumps require no further animal handling or external connections. The ALZET pump is powered by osmotic pressure, which is created by a built-in osmotic chamber. When the pump is implanted, interstitial fluid is absorbed across the semi-permeable outer membrane. The entering fluid swells the osmotic chamber, which compresses the pump's reservoir and forces out an equal volume of test solution through the flow moderator. The release rate is determined by the hydraulic conductivity of the pump's outer membrane and is not affected by the concentration of the test agent. ALZET osmotic pumps have programmed delivery rates from 0.11 microliters per hour to 10 microliters per hour. Their operational duration ranges from 1 day to 6 weeks, depending on the model and the delivery rate that is selected. When choosing a pump, consider the volume to be delivered, the delivery duration needed, the implantation site, and the animal's size. The pumps can be implanted subcutaneously in animals as small as 10 grams in body weight. This adult mouse underwent subcutaneous implantation of a 200 microliter pump just moments earlier. When properly implanted, the ALZET osmotic pump causes no evident discomfort to the test animal. Once you have selected the appropriate pump, familiarize yourself with the detailed instructions included in the package. Take particular note of the lot-specific fill volume and release rate. Carefully read the instructions on how to fill the pump. The pumps are packaged under sterile conditions. Using aseptic technique, fill the pump in a laminar flow hood. Use the filling tube that is supplied to fill the pump completely, making sure there are no air bubbles. Remove the tube and set the flow moderator in place. ALZET pumps can be implanted subcutaneously or intraperitoneally. Regardless of the implantation site, aseptic technique should be followed. To prepare the animal for implantation, anesthetize it using either an inhalant or injectable anesthetic. Shave and surgically prep the back. Make an incision adjacent to the site chosen for the pump placement, such as in the mid-scapular region on the animal's back, as shown here. Insert a hemostat into the incision. Then spread a tunnel caudally underneath the skin to make a pocket for the pump. Insert a filled pump, delivery port first. Close the incision with wound clips. The pump should remain in place no longer than 1 1/2 times its operating duration. It cannot be reused. Begin the intraperitoneal implantation by making a 1 centimeter skin incision along the midline. Using forceps, tent up the musculoperitoneal layer while incising it to avoid damage to the internal organs. Insert the filled pump delivery port first. Close the musculoperitoneal layer with voro-absorbable sutures in either a continuous or simple interrupted pattern. Close the skin incision with wound clips or absorbable sutures. As you can see, these procedures are simple to perform and can save a great deal of time compared to chronic injections. The pumps can also be used for localized application by attaching a catheter. This does not alter the pumping rate. The catheter can direct the infusion to a target area, either by intravascular infusion or by infusion directly into solid tissue. Catheter tubing should be biocompatible and compatible with the test solution. PE60 or vinyl are good choices for most applications. Attach the catheter to the pump by connecting it to the flow moderator. For some applications, it is useful to have a small flange at the tip of the catheter to secure it in place. To flange a polyethylene catheter, hold the end near a heat source. A cautery tip or flame will do. Rotate the edge for a smooth, even flange. When performing an intragastric infusion, shave and surgically prep the abdominal wall. Make a skin incision. Then an incision in the peritoneum. Isolate the stomach. Sew continuous sutures in a circle through the serosal layer and outer muscular layer of the stomach wall, forming a purse string pattern. 3 or 4 stitches should be sufficient. Leave a loose purse string. Insert the pump into the peritoneal cavity, leaving the flanged end of the catheter accessible. Perforate the stomach wall in the center of the purse string suture with the closed tips of a pair of sharp scissors or a number 11 scalpel. Enlarge the incision using a mosquito hemostat or scissors. Insert the flanged end of the catheter into the incision. Pull the purse string suture snugly around the catheter. The flange prevents the catheter from slipping out. Put an extra tie around the catheter to secure it. Using simple continuous or simple interrupted sutures, close the peritoneum. Close the skin incision with wound clips or sutures. Intravenous infusion through the external jugular vein is accomplished using a catheter attached to a subcutaneously implanted pump. Shave and surgically prep the ventral neck area. For easy manipulation during surgery, the animal can be placed into a sterile stockinette. Expose the head and neck for the administration of anesthesia and for surgical access. Place a bolster under the neck to expose the area more fully. Make an incision on one side of the midline and spread the tissue along the head-to-tail axis. Using blunt dissection, isolate the external jugular vein from the surrounding connective tissue. Elevate the vein and loosely place 2 4/0 silk sutures around the vein. Tie off the cephalic suture and loosely tie the cardiac suture. Attach hemostats to both sutures to provide gentle countertraction on the vein as needed. Using sharp, curved iris or micro scissors, remove a small piece of the vein wall. Insert the catheter. in this case PE60, into the vein lumen. Advance the catheter gently, about 2 centimeters toward the right atrium. Then securely tie the catheter with the cardiac suture, being careful not to crimp the catheter. Next, tie the ends of the cephalic suture around the catheter. A third suture can be placed around the vessel and catheter to secure it further. Then use a hemostat to spread open a pocket subdermally in the side of the neck. Insert the filled pump and close the incision with wound clips. Before performing intracerebral infusion, attach a brain infusion cannula via catheter to the flow moderator. Components of the ALZET brain infusion kit are shown here. The catheter should be 25% longer than the distance between the site of the subcutaneous pump placement and the cannula to allow free movement of the animal's neck. Fill the brain infusion assembly through a spare piece of tubing using a blunt 23-gauge needle. Then remove the spare tubing and insert the flow moderator into the filled pump. After shaving and cleaning the scalp, place the animal in a stereotaxic apparatus fitted with a nose cone for anesthesia. Make a midline incision through the scalp to the cranium. Forceps or stay sutures can be used to expose the area. Remove any connective tissue from the skull surface and dry the skull thoroughly, cauterizing any bleeding vessels. Drill through the cranium at the stereotaxically defined point. In this case, a small electric drill is used to begin, and a 25-gauge needle is used to finish. This results in a snug fit for the brain cannula. Insert a cannula, in this case from an ALZET Brain Infusion Kit 2, into the cannula holder on the stereotaxic apparatus, and lower it into the drilled hole. Gently remove the cannula holder. Just to one side, place a small anchor screw. This serves as a brace, but does not go through the bone. Secure the cannula and screw with dental cement. The cement can either be pre-mixed and then placed over the cannula and screw, as shown here, or you can place the powder over the area and then apply the solvent. Make a subcutaneous pocket on the animal's back to hold the pump. Pass a filled pump into the pocket, leaving the catheter with a generous amount of slack to permit free head and neck movement. Gently remove the cannula's plastic handling tab, leaving the low-profile cannula in place. A small amount of cement can be applied over the cannula to provide an even smoother surface, conducive to wound healing. After the cement has set, close the skin incision with interrupted sutures or wound clips. The ALZET Osmotic Pump can also be used for intracerebral infusion in a mouse. You can adapt the procedure to the thin mouse skull by replacing the cement with cyanoacrylate adhesive and eliminating the small screw. Each of the surgical techniques being demonstrated should be undertaken only with appropriate training and the supervision of an experienced surgeon. In particular, intrathecal infusion is technically challenging and carries with it a higher potential for morbidity. For intrathecal cannulation, fine tubing is needed to minimize nerve damage. For polyethylene tubing, one can use a heat source to finely stretch PE60 or to join it with PE10. The unaltered end of the PE60 tubing will attach to the ALZET pump, while the fine gauge end will be inserted intrathecally. Tie a small loop in the tubing at the point where the catheter will exit the intrathecal space. This is used to secure the catheter. Anesthetize the animal and shave and clean its head and neck. Position the animal in a stereotaxic apparatus. Incise the skin over the base of the skull and dissect down through the muscle to the dura overlying the cisterna magna. Large curved forceps may be used to retract the muscle. Incise the dura using a bent 25-gauge needle. The return of cerebral spinal fluid signals intrathecal access. Blot the area sparingly to maintain visibility, taking care not to remove fluid from the intrathecal space. Flex the animal's neck by lowering the incisor bars on the stereotaxic apparatus. Insert the catheter gently to the desired level using its natural curve to keep the advancing tip from damaging the spinal cord. Secure the catheter with a 3/0 absorbable suture placed through the catheter loop and the overlying muscle. Close the muscle with sutures on either side of the catheter. Make a subcutaneous pocket on the animal's back to hold the pump. Attach the catheter to the pump by connecting it to the flow moderator. Pass a filled pump into the pocket. Then close the skin with wound clips or interrupted sutures. An ALZET osmotic pump and coiled tube can be used to generate a controlled time-varying program of drug or hormone administration. This technique can be used to alternate between two test compounds. It can also be used to create an on-off pattern with one test agent by alternately loading the coil with segments of test agent separated by a neutral spacer such as oil or air. The coil can also serve as an external reservoir if the solvent is not compatible with the pump reservoir. To make the coil, wrap PE60 tubing around an 8 mm glass rod. Submerge the coil into boiling water for 60 seconds. Then remove the glass rod and plunge the coil into cold water. This procedure makes a permanent coil. Next, attach the coil to the ALZET osmotic pump. To load the auxiliary reservoir coil, insert a Y adapter into the tubing and connect 2 microsyringes. Alternately load the coil with a solution from syringe A and a solution from syringe B. For demonstration purposes, mineral oil and air are being used here. When the filled coil is attached to the pump, its constant action will displace the fluid from the coil, resulting in an alternating series of infusions into the animal, or in controlled delivery of a drug solution incompatible with the pump interior. ALZET osmotic pumps make possible experimental designs that require continuous delivery of bioactive agents, even delivery targeted to a specific tissue. These unique pumps have distinct advantages over other administration methods. They allow the precise, controlled delivery of bioactive agents, including peptides with short half-lives. They provide a simple and convenient method of maintaining constant levels of agents in plasma and tissues. They eliminate the stress of frequent animal handling. They reduce the costs of technician time associated with other delivery methods. We recognize that the ideas and experiences of researchers are key to the development of products and techniques that will best serve the scientific community. If you have any suggestions or questions about ALZET products or about the procedures that have been demonstrated, please contact us. At Direct, we are committed to working with you toward reaching your research goals. Our goal is to create products that will maximize the potential of your research laboratory.